Under the flyovers of modern Delhi, a virtual sea of broken bodies. Hundreds of homeless men who live by pulling a rickshaw or sorting and selling garbage. They left their homes in the poverty belts of North India in search of work in the big city. And this is where most of them end up, in Yamuna Bazaar, on the banks of the Yamuna River. There is a high prevalence of injecting drug use and HIV infection here. And right in the midst of this community, a small and very basic centre seeks to reduce the harm. It's a non-judgmental space. A number of people on the staff are former drug users, and the services include counselling for HIV testing, a needle syringe exchange program to discourage needle sharing, which leads to HIV. Used needles and syringes are collected from them. In another room, trained staff provide opioid substitution therapy. Under the supervision, buprenorphine is taken orally. It reduces injecting drug use since the clients experience less intense drug cravings. There's also a wound and abscess clinic, and this drug user was hit by a car while he was asleep on the roadside. This targeted intervention under the Delhi State AIDS Control Society is run by Sharan, an NGO, one of many programs across the country that engages with high-risk and marginalized populations like sex workers, men who have sex with men, transgenders, and injecting drug users. Among the men we meet today is a former employee of a club, a wholesale vegetable seller, and a daily wage laborer. They say their injecting drug use is tapering off, reducing the risk of HIV.
काफ़ी फ़र्क आ गया मेरे को, मतलब मेरा शरीर जो है अच्छा हो गया, बिल्कुल दिमाग भी मेरा अच्छा हो गया, मैं मेहनत भी कर सकता हूँ।
आप पूरा बंद करना चाहते हैं?
हाँ, बंद करना चाहता हूँ मैं।
However, to ensure adherence to the treatment, they need much more. A detox program and an income generation program to help them reintegrate into society.
At this centre, while outcomes are good, the community of injecting drug users is very fragile. To provide enhanced services, the centre needs solidity of investment. While civil society groups are grappling with the critical issue of scaling up services, there comes news of an administrative decision that they believe has implications for the future. This month, the Health Ministry merged the Department of AIDS Control with the Department of Health and Family Welfare. The ministry says the consolidation of two departments is in line with Prime Minister Narendra Modi's agenda of minimum government and maximum governance. Also, it is a return to the situation as it existed before.
It's no longer Department of AIDS Control. NACO will be governed by the Department of Health and Family Welfare. So there will be no secretary there. It will function a vertical program within a Department of Health and Family Welfare. Like we have different vertical programs for control of TB, vector-borne diseases, and so on. One of the additional secretaries who are working under me will be given the charge of looking after NACO so that the day-to-day works can be mostly disposed of at his level. Of course, he will send policy files and those which he deems important to me.
In the last 25 odd years, India's HIV/AIDS program has been through a number of different avatars, and each was seeking to make a positive impact. So why is its latest avatar causing such a crisis of confidence among AIDS experts and the community?
The idea of how HIV should be mainstreamed into the Ministry of Health and bring in the strengths of the ministry is not new. But activists are asking whether it is the appropriate time. More important, will the National AIDS Control Organization retain its financial and functional autonomy?
HIV is so real. It's not as if, like polio, we have completed the game and we need to be just watchful. Only 50% of the game has been won. 1 out of 2 people have been averted from being infected, which means the other one is getting infected. The autonomous nature has shown us that HIV is a preventable disease in India, provided resources go in time and the supply chain is not disrupted.
Very high apprehensions. It definitely means that the focus, which is very important to be on HIV programs, has decreased. It has shown progressive improvement, maximum after it became Department of AIDS Control, because decision making became faster, responses became faster.
When you're transitioning that back into a health system, what are going to be the generation losses? What are we going to lose out on? Now, our whole problem here is that this program had just started off and it needs to be strengthened and built. As I was saying, our targets and our numbers game are talking about 10 years ago. What has happened since then? In new populations, in new areas, in new states, we are finding that there is new evidence of HIV transmission. There is new evidence of TB, of NDR-TB, which is working in synergies, and we are actually reducing the scale and the scope of our interventions.
I don't think it's the right time to take such a decision because this program has a lot of implications. Basically, this program is working with the key population, FSW, sex workers, men who have sex with the men, transgender population, injecting drug users, even the migrants and the trucker population. So there are a lot of technical issues related with the program. I am not sure whether our system, existing government system or our system is equipped to handle such issues.